Yeah, that's very true. That's a good point about mindfulness though. And like it does lead to more happiness the more mentally present you can be. And that is a difficult feat that we all have to work on, whatever strategies you can use.
Absolutely.
I think you tend to work at some of our smaller facilities, so you work in smaller ER settings more frequently. What kind of stuff what kind of like culture do you try to set or mindsets do you bring to a smaller facility where I guess my point is your attitude has much more influence on those around you than in like a big ER setting where everyone's kind of running around, kind of doing their own thing. They don't necessarily see your attitude throughout the day. In smaller facilities where you're the only physician and there's only a handful of other staff, I feel like they look at you and how you're handling things. Like, what kind of things do you do to try to set the right tone?
You set the tone before you even walk in the door. If you ever are hanging around the nurses station at one of these smaller facilities before shift change, what you hear is, "Hey, who's coming on?" And then they automatically decide right then and there if it's going to be a good or bad night.
Yeah.
And I remember doing that as a tech, and with the nursing staff, we'd look at the doc schedule and we'd know it's going to be this kind of night or that kind of night. And that's a lot of pressure because your reputation precedes you at that point. And the first shifts that you have in a place, that's where you actually set the tone. Yeah. And so those first shifts are really important.
Yeah, that's
unless you get a completely new set of staff in between. But of course, you can make up for mistakes over time. But yeah, you're totally right. At the smaller places, and I've worked at tons of places where it's just the doctor and a nurse or two or three at the most, and then a radiology lab tech of some kind and a registration person. That's everyone in the hospital or in the facility. And you're absolutely right. Like basically the way you walk in, the first things you say, your demeanor. If you come in frustrated, it immediately rubs off. And if you come in bitching about the system or complaining about X, Y, or Z, it just immediately changes things. So just coming in and trying to smile, and that's really hard to do at 7 a.m. or p.m. in my case. It's nobody feels like smiling on their way to work usually. I think every American can relate to that. Anyone can, and it's something that if you force can make a big difference. And just doing that, and then certainly even if you can't do that, avoiding any kind of negative comment right away. I'm not saying you have to be that way the entire shift. Maybe met a few people that can do that, but I'm not one of them. I am a default melancholy person. I will find things to criticize and to, just throw little things out there, but trying to be mindful of controlling that can make the next 12 hours a totally different environment for sure. And especially when you're dealing with difficult patients, because you have to motivate your team, and it's hard to get them to do things or want them to do things a certain way or even do them at all if you're acting like it's a waste of time yourself. You're like, oh, I guess I'll get this CT because I'm forced to, because of the D-dimer, or because they said X, Y, or Z. It's like, well, if you frame things, I try to walk out of each room and be like, okay, this is what I think might be going on. This is the plan. And if you frame things as, okay, we're going to try to find this problem and give them something to worry about. A lot of the times the negative attitudes go away. And it's hard sometimes to avoid that rubbing off on you too. It can go both ways for sure. But you're right. As the one of two providers in a small facility, everything rolls downstream. It totally changes every interaction.
Yeah. It's so easy to let the negative comments really spiral if everybody jumps on board with the negative attitude. And yeah, I think when you come out of a room and you're like, well, these are the differentials I'm concerned about. This is what we're going to work them up for. Because it avoids this attitude of it seems to me there's usually like two attitudes. Like, this patient is really sick. Why did they come here? Or this patient's not sick at all. Why did they come here? And it's always this, why did they come here for this? It's like, well, it's our job to work them up appropriately. Maybe they don't need any testing today. But we're here because they think something emergent's going on or whatever the reason is. And this is our job, and we'll still take good care of them, even if they're not dying. And if they are dying, we'll take really good care of them and get them to a bigger facility where the specialists are,
Being a good example goes a long way.
Yeah.
And that means different things for different people, but, especially when you approach it from a theological perspective, we're all supposed to be examples of Christ. If you call yourself Christian, that's how you're supposed to behave. And so it's tough to look at yourself that way on a shift, because I'm like, dang, I don't think Christ would act this way or say this. And you can see that in my last shift. So it's obviously a work in progress that we have to strive to be that way, but none of us are perfect. But keeping that in mind, just that simple thought can make a huge difference, because they see you act this way and it inspires them to act that way too.
Yeah. I mean, we're called to be Jesus's hands and feet, and we're in kind of a unique situation where we actually get placed in that situation a lot more easily than
they're
most
brought
jobs.
to us.
Yeah, they're brought to us. Yeah.
The opportunities to perform what are known to me as the corporal works of mercy are there and abundant.
Yeah.
And so that's how you stay motivated to take care of the homeless person that checks in every day.
Yeah, 100%.
It's pretty much laid out in Matthew 25, like, clothe the naked, feed the hungry, give drink to the thirsty.
And we don't have to seek it out. They're brought to us, and
exactly.
we can do that.
Even the visit the imprisoned, that we have prisoners come to us. It's just a unique opportunity that we have to show them compassion, because we have all these metrics that we have in our lives, our professional lives. The number of patients per day, the RVUs per patient, the length of stay, the big ones that the hospital cares about. But the metric of heaven, according to what our Lord told us, is mercy. And that, I feel like, can really go a long way, is showing mercy.
Yeah. And that mindset makes it so that you are much less likely to miss something, and you take so much better care of people too. So, I mean, even from like a medical legal standpoint, that attitude will make you a much better clinician.
Two birds with one stone.
Yeah, 100%.
Yep.
I talked to a physician on here that he lost his kid at a very young age, turned to alcohol, realized that that's very obvious when you're at work intoxicated, turned to opioids, and lost his license, got found out, became homeless for a period of time, and was actually able to get on Suboxone, was able to overcome his opiate addiction, got his license back, and is now like a higher level, like leading position in a hospital now. But I think like talking with him kind of made me realize we're not that far removed from some of the meth addicts, the homeless. Like, I can't imagine if I lost a kid, what that would do to me. And you're only a couple decisions away from being that person, and you don't know what their story is. You don't know how they got to this position, but it's usually for a reason. It's not like poor moral character that I think is what we assign to the alcoholic, the meth addicted, is like, oh, they just don't have good morals. They have no discipline. And usually it's their life story led them there. And you're like, and I'm not that far removed from you. We're still both humans, and you've had a really hard life. And that just helps you have the right perspective when you approach.
Absolutely. And I'm not saying that there's not times when we have to lay down the law in such a way that, like, this person is using X and Y resources too many times. We're not going to, do a huge $1 million workup. I'm not saying that that's what's required to show mercy. I'm saying talk to them like a human being, and just remember, like, it's super hard to remember when you're looking at a lice-covered person that's, got meth picking all over their body, and they're there for a toothache that they've never seen a dentist for. But literally what we believe as Christians, what's in scripture and tradition is that's Jesus. That's how God's showing himself to us in human suffering.
Mm-hmm.
And we have to respond to that.
Yeah, that's good. What advice do you give like medical students when they're with you for a shift, and what kind of mindset stuff? I mean, obviously you're teaching them the medicine and all that kind of stuff, but what kind of mindset stuff do you try to convey to these early medical students that are launching their career?
I tell them to spend as much time with patients as they need. Like, don't start as trying to be the fast person, because that's going to immediately lead you to a path of burnout and possibly failure and making mistakes. Just taking your time. Obviously, you can't spend an hour with every single patient. There's probably going to be someone that's dying that you haven't seen yet. But doing due diligence. There's times when I've delayed discharge of a patient by 4 or 5 hours because I know eventually I'm going to have time to go back and talk to them more, and then I'm going to know exactly what's going on. And sometimes you have to do things like that, and it doesn't make people happy. The nurses are always asking, why haven't you discharged this person? All of their tests have come back. Well, the most important part hasn't happened yet. Me sitting down and talking to them is the most important part. Because half the time, at the end of the day, when you look at tests that have been quickly ordered in intake based on a Gestalt feeling, which I think is excellent and on point many of the times, like you hear the person for 30 seconds, you order a CTPE study, and lo and behold, that's what it is. Like, we do that a lot. We're pretty good at it. But there's probably 30-40% of those people that if you had more time, you could figure out what they actually need. And the answer is usually not easy as popping on a radiograph.
That's a great point. I think it's easy to get that bias from the triage, who sees somebody for 30 seconds, throws in a bunch of orders, they're roomed, their results are back, nursing's getting on you to be like, they're resulted, they can be discharged. You're like, well, resulted does not equal discharge necessarily. A bunch of negative tests don't equal discharge necessarily. And that disposition piece where you have a workup and you need to go talk to the patient, that is the most important part, And it's hard to overcome that bias of assuming what's going on is what somebody who talked to them up front for 30 seconds assumed was going on. And like you said, a lot of times they are right on, but that's not the case every time. And if you don't take that extra time to talk with someone, that stuff can get missed, when it's, a bunch of negative stuff, discharge them. Right.
Yeah. It's, and it happens in other settings too, like pre-hospital report. I grew up in and around EMS, and I know the frustration of when the receiving team doesn't listen to you. There's a lot of important details there a lot of the time, but pre-hospital providers should be aware of their potential to bias us. And when they come in, they're like, this is the diagnosis, and like this is all you have to do, and then you can discharge them. Like, sometimes they'll say that. I'm like, whoa, like, slow down.
Yep.
How long did you have with them? Oh, it was a 5-minute ride. Like, it's different if you sat there for an hour, but like it can really set things off on the wrong path sometimes.
Totally. And I have all the grace for the EMS crews. I mean, I was an EMT and paramedic for a decade, so I get it. But they do, I think even when I was a paramedic and EMT, I didn't really understand the problem of passing on a strong bias to the physician when you're giving handoff report. I mean, I can think of a patient a few months ago that came in with vomiting, diarrhea, and the EMS crew's like, we can't believe they even called 911 for this. Like, this patient's not sick. And usually that puts up a red flag in my brain that I'm going to probably order more out of caution, because now I know I'm being influenced by this bias, that this is not high acuity. They have nothing going on. They're fine. They shouldn't have come in by ambulance. And that usually puts up a red flag that I need to do a little more investigation. And this patient, the mom showed up, and it was one of those patients, like, all the results look great. I wasn't concerned about my physical exam. I go back in and mom's like, I think she has appendicitis. Like, this is not her at all. And I was like, that's radiation. Like, I'm really not worried about it on my exam. And mom was really adamant about it. And I said, okay, well, we'll do the CAT scan. And sure enough, acute appendicitis. I take mom gestalt a lot more
Yeah,
seriously
that's
now.
an easy pearl for anybody is like, don't think seriously at least before disregarding the mama bear because there's something there.
Yeah.
And there's times when you have to fight the fight of no radiation, whatever, but it's usually not a fight worth fighting in our line of work.
100%.
Yeah.
Yeah, totally. We've talked a little bit about kind of faith and stuff, but just generally, how does your faith influence how you handle kind of the pressure and the challenges with emergency medicine?
In a lot of different ways, from really specific instances, like things we were talking about, like the homeless person that shows up and they're literally just hungry or wet and they need new clothes. Those are, I try not to get angry like the instinct is. It just becomes instinct. When you do this long enough, you're like, why are you here? This doesn't make sense. But you can do a small act of mercy, and that helps that person. And it also, at least from my theological background, which is traditional Catholicism, those acts of mercy actually merit us spiritually. It would be useful. I think that you'd be. It's a simple thing, but life's not that simple, and we have to make a lot of complex decisions, a lot of complex interactions, and a lot of it is tough, like to even listen to or be around. And I think remembering our number one charge, which is charity, be charitable. I think that, especially with these like angry people and intoxicated people, suicidal people, just being kind and charitable, and not immediately, like, we've all barked at someone in some way or some fashion and said something negative. It's really easy. It's as easy as like, well, what, don't you do anything to take care of your glucose? Why is it 500? I'm not saying they don't need that, because we have a duty to educate people. But there's a way to say things charitably, even if you completely disagree with what they do and how they live their life.
Yeah.
There's a way to say it charitably and still show mercy. And I think that's the most assured way to keep yourself sane.
And I think when you approach it with that attitude of having mercy, it makes you word it the correct way as well. So it'll actually be received. Because I mean, there's so many wrong ways and untactful ways to approach that kind of stuff. Like, why aren't you checking your glucose? Like, this, there's a right and a wrong way to really word that to a patient and discuss things with a patient. And if you approach it with, this is another human, like, I need to have mercy for all people, it makes you word things the correct way where the patient can actually receive it too. Because if you're going to say, hey, you need to quit smoking, and it's just this offhanded comment that doesn't really go anywhere. But if you've actually spoken with them and listened to them and heard their story a little bit, just taking that extra couple of minutes, and then you say, hey, you should probably quit smoking, they actually take that a lot better than if you just say you need to quit smoking.
Absolutely, yeah. No doubt about that.
Yeah.
And another way that, I feel like sometimes we do nothing for these people. Sometimes there's nothing we can do for them. They come with an insolvable problem. And those are the opportunities to do something that benefits them and you. That can be super simple as giving them the sandwich or the blanket, or it can be talking them through a tough moment, or a death. Showing mercy at that time is a big one. Like, I've seen every which way of handling that situation, from being a tech and just seeing hundreds of different doctors do it. And it's a unique time because, as a Christian, I believe in the resurrection of the body. The body is sacred, and just the act of making sure the body's neat and covered with a sheet and prepared for the family to come in is an act of mercy.
Yeah.
And that could be all you do.
Yeah.
But showing compassion and respecting the fact that that person, like we respect this person and their existence and their soul.
Yeah, and that can't be understated. I think I tried to do that as a paramedic too, where, we had a lot of cardiac arrest in the field that we don't transport. And we do all these things to the body. We intubate them. There's pads, there's stickers all over them. There's IVs in them. There's an IO in their shin bone. All these things we do to somebody to try to fix that cardiac arrest. And then, if you just bring in the family, you haven't covered them with a blanket. Usually you've taken off a lot of their clothes. It can be very disorienting to the family. And just taking that extra minute to be like, do we need to keep this tube in their mouth? Do we need to keep all this stuff in place? Can we make them have a little more dignity by covering them with a blanket? Just doing a couple little things, I think, makes it much easier for family.
And doing those small things are what keep you going, because that's how you feel real satisfaction, when you're doing things that matter and not just clocking in and clocking out.
Yeah, totally. Is there any practices you have when you're on shift to recenter yourself, reorient yourself to your purpose and why you're doing the job?
Yeah, I mean, I think it's easy to get negative when you're not taking care of the basic things. So reminding yourself to eat, drink, pee, those things can help you just be focused and in the moment. And then some kind of exercise, I've found, just stepping away from all the action and just taking some deep breaths. That's, I think, somewhat scientifically based in terms of being able to relax the mind and recenter. And I like to do that while praying about whatever I am conflicted or feeling suboptimal about at the time. Sometimes it's just simple as praying for that patient, or praying that I can figure out what to do next. Because we've constantly, part of our job, the unique nature of emergency medicine is we operate strictly in the gray area. There's never a black and white. I mean, sometimes we get close. Sometimes the CAT scan shows appendicitis, and we're like, yeah, we're pretty sure it's appendicitis. But most of the time it's not. Most of the time it's I think it's a COPD exacerbation, and we're going to try this. But if that doesn't work, we're going to have to go back to the drawing board and things like that.
Yeah,
and,
it is a weird specialty. And I mean, medicine in general, nothing's 100%. Even the appendicitis, sometimes the surgeon's like, oh, not appendicitis.
Right.
Like, well, okay.
And they're like, duh, it was the ovarian cyst. It was like, well.
Yeah.
Or the medicine admit where you're like, I ended up treating them for COPD and CHF and this, and we got a migraine cocktail and a CAT scan of their head. And they're like, oh, what the hell are you doing down there? Treat the condition. Yeah. It's like, well, it's not clear. It's never clear. And I think taking a moment to recenter yourself, and I think being spiritual in that time can be extremely helpful.
Yeah.